Hi, I am Dr. Kristine Kiat. I'm a board-certified pediatrician, and in today's video, we will talk about diarrhea in children. I will focus the discussion on acute gastroenteritis as the cause of the acute diarrhea. Then we will discuss about dehydration and how to assess it, because it is an important indicator on how severe the disease is. Then we will talk about diagnostic tests, treatment, and prevention. More importantly, watch up until the end of the video because I will talk about action steps on what you can do to help your child. So enjoy watching, alright? Diarrhea in children. According to the World Health Organization, diarrheal disease is the second leading cause of death in children less than 5 years of age. There are about 760,000 deaths in a year in this age group. And majority of cases is due to acute gastroenteritis. And like I've mentioned, the degree of dehydration is the most important indicator of the disease severity. Diarrhea is defined as stools or poop that is more frequent and looser than your regular stool. It may contain blood, mucus, or undigested food particles. Well, parents usually worry about the color of the stool. The only thing you should worry about if the stool is red, which might indicate blood, if it is black tarry, which might indicate an upper GI bleeding, or if it's acholic or pale or clay colored. What is acute gastroenteritis? It is an infection wherein the stomach and intestines are irritated. You might get it from contact with a person with this disease, from contaminated food or water, or from unwashed hands. It is an acute diarrhea that may last from several hours to a couple of days. So what are the causes of acute gastroenteritis? Most commonly, acute gastroenteritis or AGE is due to viruses. Can also be due to bacteria, which might lead to bloody diarrhea, and might also be due to parasites. What are the symptoms of a child with acute gastroenteritis? So first off, there is diarrhea or frequent loose or watery stool. Can also be bloody. Then the child might also have fever, abdominal pain or belly pain, nausea, vomiting, loss of appetite, and sometimes weight loss, and might also be dehydrated. Diarrhea can lead to dehydration, which is what we should watch out for. It leads to dehydration because of an increased loss of water and electrolytes from the diarrhea, especially when it is not adequately replaced. Children who are also vomiting can get dehydrated quickly. Now, what are the signs that you should watch out for that might indicate that your child may be dehydrated? First, if there is decreased urination or if your child is not peeing normally, if there is increased thirst, if there are no tears when crying, if the skin, mouth, and tongue are dry, if the eyes are sunken, and if the fontanelle or the soft spot in the head in babies is sunken as well. And lastly, when the heartbeat is fast. If your child is already showing signs of dehydration, you should bring him or her to the doctor. Then, the doctor might do additional diagnostic tests such as a stool exam to determine the cause of the diarrhea. Stool exam is needed in times of outbreak in school or daycare or in the hospital setting. Stool exam might also be needed if the diarrhea is bloody and if it has been going on for a long time. So how do we treat diarrhea? First off, we need to prevent dehydration. This is brought about by ongoing fluid losses either from the diarrhea or from the vomiting. We give an ORS or oral rehydration salt which contains specific amounts of sugar, fluid, and salt that would help replace and prevent dehydration. Also, avoid giving sugary drinks or soda because it might only worsen the diarrhea. And also, avoid giving plain water because it might lead to decreased sugar levels in the blood and decreased sodium levels as well. So it is best to give ORS or oral rehydration salt. In some cases, when the diarrhea is worse or the child is moderate to severely dehydrated due to persistent vomiting, or if he can't keep anything down, or if you tried ORS but the child still cannot take it, then you might need to bring the child to the emergency room and might need to be admitted for rehydration through an intravenous fluid, which is an IV through the vein. We need to continue breastfeeding, even though the child is having an acute gastroenteritis or having a diarrhea. Zinc supplements might be helpful, especially for children in developing countries, wherein there are cases that might be associated with malnutrition. Probiotics, which are live microorganisms, are helpful because studies have shown that it might lead to decreased duration and severity of the diarrheal illness. All right, now we're in the action steps, or steps on what you can do right now to help your child prevent the diarrhea or treat the diarrhea. Action step 1, proper hand washing is important. Action step 2, avoid eating raw or undercooked meat and fish, and also avoid eating food from street vendors. Action step 3, ask your doctor if your baby has had rotavirus vaccinations. Currently, there are 2 licensed rotavirus vaccines available. And since the introduction of the rotavirus vaccines, studies have shown that there has been reduced hospitalizations due to diarrheal illness. Action step 4, give ORS or oral rehydration salt to prevent dehydration. Action step 5, continue breastfeeding. Action step 6, give probiotics. It has been proven to be helpful by reducing the duration and severity of the diarrhea. And lastly, action step 7, know when to call your doctor. Signs that you should call your doctor include if your child seems very sick, if the diarrhea has lasted for more than 3 days, if the baby is younger than 6 months, if the child is vomiting blood, or if there is greenish fluid, if the child can't hold any fluid down, if there is persistent fever, if the child seems dehydrated, if there is bloody stool, if the child passes more than 4 diarrheal stools in 8 hours and is not drinking enough, if the child has a weak immune system, or if the child has a rash, if the child is complaining of stomach pain for more than 2 hours, and if there is no urine output for more than 6 hours in a baby or more than 12 hours in a child. All right, that's the end of our video. I hope you enjoyed it and learned a lot. Thanks for watching. Hi, I hope you enjoyed the video. I am here to provide support and help you raise happy and healthy kids. If you have any questions or if you want to suggest a topic, just type in the comments below. And don't forget to hit like, subscribe, and the bell button to keep posted. Alright?